5 items you must have as a nurse. Hello guys, welcome back to my YouTube channel. Welcome back. My name is Nurse Goreti Ogo. I'm a nursing student in my final year in University of Nigeria Nogo campus. You're welcome. Can you hit the subscribe button? Subscribe to this channel. I bring you topics on nursing, lifestyle, and health. On today's video, we will be talking about 5 items you must have as a nurse. As a nursing student, those questions will be going through your mind. What do I need if I start practicing as a nurse? What are the items that I need? Well, I'm here to answer that question. I'm here to clarify you on that question that you may be having. So number 1 item you must have as a nurse is a stethoscope. That's number 1. A lot of students don't even have stethoscope, to be honest. A whole lot of students don't have stethoscope. In our second year or thereabouts, I think they made it compulsory for every student to get a stethoscope at least. It's an item that every nurse should have. When we go for clinical postings, I discovered that nurses working in the hospital, they rely on the stethoscope provided by the hospital. Whereas that may not really be hygienic for both you and your patients, because if it is your own personal item, you will know how to take proper care of it, unlike when it is for general use, when everyone is using it, for students and then you nurse, you are using it. Nobody cleans it, nobody takes care of the stethoscope. Everybody uses it as they pleases. So it's very important that you have your own personal stethoscope that you use in checking your patients, and then you take care of it after every use. You clean it with maybe methylated spirit, or you just thoroughly clean it after every use, and it will be clean. So it is a very important item you must have as a nurse. Number 2, a click pen. And by click pen, I don't mean normal pen. There are those pens that you could easily click this way and they will go in, and then you will attach it to your clothes. You know, as nurses, we document every single time, so you need a pen that is always handy. If you get a pen that you attach the cap and remove it, at some point you may lose the cap, and then you may not want to put the pen in your pocket. But a click pen is a pen that it can easily click on it, and then the mouth of the pen will go in, and then you'll be able to attach it to your pocket, and you won't easily lose the pen, because you must always have your pen handy every time as a nurse. Third item that you must have as a nurse is a good scrub. A good scrub. I see some nurses who wear worn out scrub, or scrubs that have lost colors. I mean, they say that people address you the way you dress, right? People address you the way you dress. If you do not dress properly, you will be addressed that way. So if your scrubs are beginning to fade away, you might need to change it. I know, especially here in Nigeria, that where we nurses are paid peanuts, they don't really pay nurses so much money, but you are supposed to change your scrub if it wears out or if it's done. Don't keep sewing and sewing and sewing. Change it once it's done and replace it once it's done or its color wears out. Don't keep on wearing it until it loses its quality. You don't know when to change your scrubs. Simple. The 4th thing that you must have is a comfortable shoe or Crocs. Most hospitals now, they use Crocs, but if you're using Crocs, don't be wearing oversized Crocs. You know, in some hospital, the hospital provide Crocs for you, especially here in Nigeria. The hospital provide Crocs for you, but it is advisable to have your own personal Crocs. Get it and take good care of it, not the general Crocs. I see some nurses wearing oversized Crocs simply because it is not their own personal Crocs. The hospital provided them, and none of the Crocs provided is their size, so they wear the oversized one, and by the time you're walking, you're dragging your feet because it's oversized. So it's important that you get a comfortable Crocs that fits you perfectly, that you can take good care of. And then after before you wear your Crocs next time, make sure you use disinfectant. Make sure you use disinfectant to clean it properly, because I mean, it's the hospital. It's the hospital. So if you're leaving your crocs at the hospital, make sure that before you wear it the next day or on your next shift, you clean it with a disinfectant so that you don't get infected at some point. And then for shoes, depending on, you can get a flat shoe, a black or nude color shoe is most preferable. Black or nude. Sometimes I see some nurses wearing white shoes with their white gown, like you're wearing a white gown, putting on a white shoe. It's insane. It's insane. It doesn't even go. Those two colors, maybe it goes, but I don't think it's good to the eyes when it's not appealing to the eyes. So it's very important that you get a good shoe. Some nurses, you see their shoes and one part is worn out, the other part, it will be like this, bent like this, and they will still be wearing it. Keep it in mind that you will be addressed the way you dress. Number 5, drug app or nursing diagnosis app. Every nurse should have a drug app or a place that you can look up drug. There are some pharmacology pocket dictionaries that you could have, but it's not as handy as when you have an app where you can easily look up a drug, where you can easily look up a drug, its dosage, its side effects, and because there are the truth is that there are a lot of drugs. At some point, no matter how conversant with drugs you are, at some point you may encounter drugs that you are not conversant with. So it's important that you just have your app handy. Have some of those apps are paid apps. You have to pay to be able to access. More, some are free apps that you can use to check the drug, the name, the dosage, the side effects, nursing diagnosis. There are apps that you can use to do so. So it's very important you have a drug app in your phone that you can easily access at any point in time. Well, this one is a bonus point on items that you should have as a nurse. This is a bonus point. The last one I want to mention is a Penlight. Penlight is an item that is used to assess the pupil. It's a device that's used to assess the pupil of the eyes. It's just like a torchlight, but it's shaped like a pen. It's shaped like a pen. That's why it's called a Penlight. So it's a torchlight, but it's shaped like a pen, and it's used to assess the pupil of the eyes. Most nurses think that it's only doctors that should assess the pupil of the eyes. Just in Nigeria, we rarely do pupil assessment. We rarely do it. We leave it for the doctors. But these are the things that we are taught in school. These are the things that we are taught, and they are part of the things that we do during assessment. But we don't do it. During admission, you're supposed to do a head-to-toe examination. When you get to the eyes, you're supposed to use a pen light to assess this thing. But because we don't even have the instruments, we don't think that it is our responsibility to do it. So it's very important you get this. By the time you get it, you will remember to do it for your patients. That is the fact. So it's important that you always have a pen light. And again, sometimes maybe you walk into a patient room, or patients are everywhere, it's dark, and then you need something to be able to, you need a light to be able to visualize things in the room. You don't just go ahead and turn the lights on because your patient might be sleeping. By the time you turn on the lights, it will affect your patient, wake up your patient. So you need that pen light that is very handy, easy to carry about in the pockets, and you can take it wherever you are going. So thank you so much. I hope you got value in today's video, and if you did, please hit the subscribe button, give me a thumbs up, and share this video. Also leave a comment for me. Tell me where you're watching from, anything, just say anything. Tell me hi, tell me where you're watching from, or ask me any question, or if you'd like me to make any other video, you can make a suggestion to me. So thank you so much for watching today's video. See you in my next video. Bye.